Dr. Zaghi is an ENT who is also a board-certified sleep surgeon. He is one of the founders of the Breathe Institute, which is a group of people who treat myofunctional disorders, sleep breathing issues in California. Dr. Zaghi and his team at the Breathe Institute have paved the way for doing lingual frenuloplasties and making the standard of care. They have done quite a bit of research to make sure that everyone is doing things very precisely so that the patients have the best outcomes. I'm an affiliate of the Breathe Institute, which means that I have personally been trained by Dr. Zaghi, which is important to the patients in our area because now they have somewhere to go in the Chicagoland area versus flying to California to be treated by Dr. Zaghi. So now that we've done our training with the Breathe Institute and Dr. Zaghi, we have a very comprehensive way of treating patients. So we diagnose exactly what each patient needs, which means we're looking at everything as a whole, besides just looking at, is the lip restricted or is the tongue restricted? We're looking at the whole facial complex and how you're breathing as well. We really make sure that our treatment plan is very individualized per person versus just saying, oh, you need a frenectomy or you need a functional frenuloplasty. We really look and make sure that everybody is treated for exactly what their needs are.
We make sure that you have myofunctional therapy before your procedure here in the office because we want to make sure that you are prepared as best as possible before you come in for your procedure. So with the myofunctional therapy, it makes sure that your tissues are ready. It makes for a much easier procedure for the doctor, which equates to a much easier procedure for you, and your outcome is way better.
One other thing that sets us apart at IDW is that we have something called a cold laser. With that cold laser, we use the day after to 2 days after having the lingual frenuloplasty done, and it helps reduce inflammation, which means that it helps reduce pain in the mouth. It helps most patients feel quite better after using it. We give everybody pain scales to go by, and everybody is usually down to like a 1 or a 2 on the pain scale afterwards. So you're able to eat a lot better, you're able to do your stretches and your myofunctional therapy a lot better afterwards. So it's something that we're really happy to have at Inspire Dental Wellness, and we're one of the only offices in the state that have it.
I'll say it was a real pleasure working with Dr. Zaghi and his team because we were able to learn some new things regarding compensations that you can do with your mouth, and he's the cutting edge leader on research. So it's exciting for us to be a part of that.